All right, this is Mr. Hospital Bed, and we are looking at the Hill Rom P7500 Progressa hospital bed. And the P7500, as you can see right away, sits fully into a chair position. Now, I've done a few other videos, and you can see that unlike other beds, they still require you get in and out the side of the bed. That's the Hill Rom VersaCare. That one there is the Centrella. But the Progressa bed actually lets you put your feet on the ground. And as I said in the previous video, there's a lot of people that it's a lot easier getting in and out of bed. If you can have somebody stand right in front and help pull them out of bed. You can drop the rail down, say over here, and say, okay, let's move them from the chair to a wheelchair. And then you can just slide them right over into another type of device to help them get around. But the Hill Rom Progressa bed is a one-of-a-kind. First off, you have a pulmonary surface. We're going to show you that. I've got one back here that I raised up that is going to be ready for a demo here in just a second. But you have the full chair position. Now, the pulmonary surface is a percussion vibration surface, meaning it'll help break up congestion in the lungs. If you're watching the video and you know somebody with COPD, pneumonia, bronchitis, or any other type of lung issues, the pulmonary surface is a real big deal. And it also has lateral rotation. Lateral rotation in common English language would be referred to as constant turning. So it can turn the person left, right, center. The mattress will actually turn the person. So caregivers don't really have to do too much. And what it does, it changes the pressure points on the body making contact with the surface. So you're not just sitting on your tailbone. It gets you over on one side of your hip, the other side of your hip. And so it's really good for a multitude of different things. It also has pulmonary benefits, which we'll get into on another video. But the P7500 Progressa has the basic foam mattress. We don't get a lot of these because this is really an ICU bed. So you know, there's the Centrella, which they use in hospitals more for foam, but the Centrella can also go with a basic air system as well. But the treatment surface here, which is the low air loss, and it does have alternating pressure, is also good for preventing bed sores and pressure wounds. So if you're looking for something and you're at risk, or the person you're getting the bed for is at risk of bed sores, you know, this is also going to be a good surface. Now, I don't want to get too much into it, but the VersaCare bed also has low air loss. So there's a couple options with Hill Rom beds that'll do that. But, you know, for all those people out there that it makes it easier to get in and out of bed, this is a big deal. And this is the only bed that really does this with an air system attached to it. So if you're looking for a bed with a chair position, now we're going to get in now and look also at some of the features that the bed has. Like I said, we've got our fully stocked showrooms are equipped with the best hospital beds on the planet. We do sell brand new beds. We sell beds from MedMiser, Invacare, Drive, Prius, all the other brands, but right now we're going to go and look. Now, one of the features that the bed has is something here called Boost, which basically means if the person is sliding down in bed, it'll help boost them up. Trendelenburg is another feature that's similar, but the mattress will also help do that. And then the most popular feature with any bed, obviously, is the chair position. And we do have the chair position in an egress. So we do have that. I'm going to show you that in just a minute. And then obviously you can put the feet up and down, and you've got the different, just your basic functions. And I like it just because it's super user friendly. It's quite clear that, one position is going to put you in a chair, and this is going to be the head up and down and what have you. Now, we're going to get into a couple features here with the mattresses. One that I don't usually do, but I'm going to do it today because this bed has the features, and we're going to go into some of the features of the mattress. Now, Max Inflate, that's really going to be used primarily to get in and out of the bed, ingress, egress, which are the technical terms. But Max Inflate makes it easier to get a Hoyer and a sling and get in and out of bed. So a lot of times that's the easiest way to get out of bed is to Max Inflate the mattress. So that'll Max Inflate for about 10, maybe 15 minutes, and then it'll return back depending on when you're done. We talked about right turn assist and left turn assist on another video, and that basically turns the person to the right for about 15 minutes, and then it allows the caregiver to change out the bed linens, bathe the person. Once you're done, turn them to the left, turn them to the right. OptiRest, seat deflate, because the bed goes fully into a chair. And then there's a sleep mode that you can go into that's going to make it quieter, so it makes it easier to sleep at night. Okay, so those are some of the core features that the mattress has. However, the next thing we're going to do is we're going to go to the lungs, and this is going to be where this bed basically is going to separate itself from every other bed on the planet Earth. The main feature here is P&V, which stands for percussion vibration. And as you can see, it has a picture of the lungs, meaning it's a pulmonary bed and it's designed to help break up congestion in the lungs. So what I'm going to do here is I'm going to hit start. And we're going to let this thing get going here. But what it's going to do is it's going to start thumping the upper respiratory system. And that's going to help break up congestion in the lungs, and it's going to make it easier for the caregiver. So this basically replicates what a respiratory therapist would do in a hospital setting. And the bed comes with a full set of controls. It has a pendant, so the person in bed, if they're able, can control the position. And then you also have another set of controls here on the rail for head up and down. But you can see here that this is a very valuable feature. It's the only bed that does this. It's the only bed that has a pulmonary feature that's actively being made right now. And we sell beds from all the major brands, and I've got all these beds, but this is the only one that really does that. Now, we're going to go ahead and stop the therapy. Yes, we're sure. I'm going to just go ahead and go back to our lungs. And now we're going to get into rotation. So turn assist is different than lateral rotation because turn assist, when you hit start, well, actually, let's stop that. I don't want it to go right into that because I want to go through the controls. With rotation, oops, it didn't stop. Okay. Oh, it's transitioning. Got it. So with the rotation feature, that'll turn the person the whole night long, meaning that when you hit start, it's not just 20 minutes to the left and 20 minutes to the right. It's actually going to turn the person until you hit stop. Now, the thing I like about it is, let's say the person's at a 30-degree turn and I want to put them at a 40-degree turn. All I have to do is hit 40%, and I can say, no, instead of 10 minutes, let's do 20 there, and let's do 40 again over here. And you can see how easy it is to use that. And once I hit start, it's going to turn the person until I say stop. That's the difference between lateral rotation and turn assist. And a lot of the mattresses have turn assist. Very few have lateral rotation. And then, of course, we talked earlier, you've got the full chair position that helps the person kind of get out of bed. And so those are some of the other features there that you've got with this bed. Now, the Hill Rom Progressa bed, like I said, is the best bed made on the planet Earth. It's not always the bed that, is going to be the best option for you, because maybe you don't need pulmonary, but maybe, the person's in bed a lot and you're looking for a bed that has a low air loss mattress system. So the goal of the videos, as always, is to give you knowledge and information on different beds, different bed models. We also sell a lot of home care brand beds, and we have a lot of different beds that we also provide. So, if you just need a real nice full electric bed with a nice foam mattress or an air mattress, there's a huge difference between home care, hospital grade care, and then low-end home care and high-end home care. And so, the goal for us is to figure out what the needs of the person in the bed are. We want to make sure that if you're in bed and you're spending a lot of time in bed, that you're getting an air system that's not going to allow skin breakdown or bed sores. And I've said it many times. If you've watched the videos, you know that bed sores are the number one reason people get readmitted into a hospital. I have seen pictures and situations of bed sores and infections that have gotten really out of control. It puts a lot of stress on the caregivers, the family, and of course, actually the person in bed. So this is a quick overview from Mr. Hospital Bed in reference to the Hill Rom P7500 Progressa bed, by far the best hospital bed made on the planet Earth. Different versions of it. Like I said, we've got some here right now with the foam mattress. We've got the treatment surface, which they call the therapy surface, which is technically alternating pressure and low air loss. This right here, the prevention surface, is a high-end foam mattress. And then the best of the best bed made on the planet Earth, the Hill Rom Progressa with the pulmonary surface. Like I said, we sell these beds all over the United States, all over the world. We've got 6 of these beds going to a new hospital in Guatemala, but these are for ALS, MS, quadriplegic, paraplegic, stroke, you name it. These beds are the best of the best. So if you're looking for a hospital bed, any type of bed, call us and ask us questions. Gloria runs California location. She's been doing this also 15 years. She's pretty much worked with me as long as we've been doing this. She's very knowledgeable. Abby and Christine, who are running through here right now, but trying to be quiet while I shoot the video, they're awesome. And of course, my name's Sean Callahan. I am AKA Mr. Hospital Bed. So if there's anything you need, visit our websites, the #1hospitalbeds.com. There's a lot of information on there. We also have a lot of information on our hospitalbedshop.com website, which is a little easier to navigate. But we've got a lot of videos, a lot of information. Give us a call. We can help. We're in Virginia. Gloria's in California. As I said in one of the other videos, today as we speak, we're delivering a bed right now in Alabama. We've got 2 in Tennessee, Illinois, and I believe Ohio. And then we've got another truck coming here shortly that's going to be taking beds up to Maryland, Pennsylvania. So we ship beds into Florida. I mean, we ship beds all over the United States, Texas, you name it. But, you know, we've got certified trained Hill Rom staff. So we have the beds certified. We have aftercare where we can get service on the beds if it's ever needed. And we can basically help you through the whole step of the process. So give us a call, USA MedBed, your one-stop shop for hospital beds. I'm Sean Callahan, AKA Mr. Hospital Bed, doing a review today on the Hill Rom Progressa. Give us a call for more information. Like, subscribe, and share, and we will see you on the next video.